Alcohol addiction in the Black community. Causes, consequences, and solutions. Alcohol addiction is a pervasive public health issue, affecting people across different racial and ethnic backgrounds. However, in the Black community, the issue is compounded by systemic factors, historical trauma, and limited access to resources. Understanding alcohol addiction in the Black community requires a nuanced examination of its causes, the unique challenges faced by this demographic, and effective strategies to address the problem. Historical and systemic factors. To understand alcohol addiction in the Black community, one must consider the historical and systemic inequalities that have shaped Black experiences in the United States and beyond. From the days of slavery to the Jim Crow era and ongoing systemic racism, Black communities have faced persistent economic and social disenfranchisement. This marginalization has created conditions conducive to substance abuse, including poverty, limited educational opportunities, and lack of access to health care. Alcohol was often introduced into Black communities as a form of social control during slavery and post-slavery eras. It was sometimes used by plantation owners to placate enslaved people and suppress resistance. During the Prohibition era, Black neighborhoods were disproportionately targeted by illegal liquor sales, further normalizing alcohol consumption. These historical factors have contributed to the normalization of alcohol use in some Black communities and the stigmatization of those who struggle with addiction. Social and economic stressors. The Black community continues to face significant social and economic stressors that contribute to higher rates of alcohol abuse. Unemployment, underemployment, housing instability, and systemic racism all create chronic stress that can lead individuals to turn to alcohol as a coping mechanism. Research shows that stress-related drinking is a common pathway to addiction, and the Black community is disproportionately affected by stressors stemming from structural inequalities. Moreover, the intersection of race and socioeconomic status often means that Black individuals are more likely to live in neighborhoods with an abundance of liquor stores and fewer resources for healthy recreation or mental health care. The oversaturation of liquor stores in predominantly Black neighborhoods is a glaring example of environmental racism, as it fosters easy access to alcohol while reinforcing cycles of addiction and poverty. Cultural attitudes and stigma. Cultural attitudes toward alcohol use within the Black community also play a role in addiction. In many cases, alcohol consumption is deeply embedded in social gatherings and celebrations, making it difficult to distinguish between recreational use and problematic drinking. While this is not unique to the Black community, cultural pride and the importance of maintaining a positive image often discourage open discussions about addiction. The stigma surrounding mental health and addiction further complicates the issue. Many Black individuals struggling with alcohol addiction are reluctant to seek help due to fear of judgment or ostracism. This reluctance is often reinforced by a lack of culturally competent mental health professionals who understand the unique challenges faced by the Black community. Consequences of alcohol addiction. The consequences of alcohol addiction in the Black community are far-reaching, impacting individuals, families, and communities. On an individual level, prolonged alcohol abuse can lead to a range of health problems, including liver disease, cardiovascular issues, and mental health disorders such as depression and anxiety. These health issues are exacerbated by disparities in access to quality health care, leaving many Black individuals without adequate treatment. On a familial level, alcohol addiction often leads to strained relationships, domestic violence, and financial instability. Families affected by addiction may experience cycles of dysfunction that perpetuate the problem across generations. Children in these households are particularly vulnerable, as they may face neglect, trauma, or an increased likelihood of developing addiction themselves. At the community level, alcohol addiction contributes to higher rates of crime, unemployment, and homelessness. These issues, in turn, perpetuate negative stereotypes about Black communities, further entrenching systemic racism and discrimination. Barriers to treatment. Despite the severity of the issue, many Black individuals face significant barriers to accessing treatment for alcohol addiction. One major barrier is the lack of affordable and culturally relevant treatment options. Traditional addiction treatment programs often fail to address the unique experiences of Black individuals, such as the impact of racism and cultural identity on addiction and recovery. Another barrier is mistrust of the healthcare system, which has been historically rooted in discriminatory practices and unethical medical experimentation on Black bodies. This mistrust makes many Black individuals hesitant to seek treatment, even when it is available. Finally, socioeconomic factors such as lack of health insurance, transportation, or time off work make it difficult for many Black individuals to attend treatment programs. These barriers highlight the need for systemic changes to make addiction treatment more accessible and inclusive. Solutions and strategies. Addressing alcohol addiction in the Black community requires a multifaceted approach that combines prevention, treatment, and systemic reform. 1. Community-based prevention programs. Grassroots organizations and community leaders play a crucial role in prevention efforts. Culturally tailored education programs that address the risks of alcohol use and promote healthy coping mechanisms can help reduce addiction rates. These programs should also focus on empowering young people by providing them with mentorship, life skills, and opportunities for personal development. 2. Culturally competent treatment. Addiction treatment programs must be designed to meet the specific needs of Black individuals. This includes hiring culturally competent counselors, incorporating discussions about racism and cultural identity into therapy, and involving families in the recovery process. Faith-based organizations, which often hold significant influence in Black communities, can also play a supportive role in providing treatment and spiritual guidance. 3. Policy changes. Policy changes are essential to address the systemic factors contributing to alcohol addiction. This includes regulating the density of liquor stores in Black neighborhoods, increasing funding for mental health and addiction services, and addressing socioeconomic inequalities. Policymakers must also prioritize criminal justice reform to ensure that individuals struggling with addiction are treated as patients rather than criminals. 4. Breaking the stigma. Reducing stigma around addiction and mental health in the Black community is critical. Public awareness campaigns that feature Black voices and challenge stereotypes can encourage more individuals to seek help. Open dialogues within families, churches, and community spaces can also help break down the barriers of silence and shame surrounding addiction. 5. Holistic approaches. Holistic approaches to addiction treatment that address physical, emotional, and spiritual well-being are particularly effective in the Black community. Practices such as yoga, meditation, and art therapy can complement traditional treatments and provide individuals with healthy ways to cope with stress. Conclusion. Alcohol addiction in the Black community is a complex issue rooted in historical, systemic, and cultural factors. While the consequences of addiction are severe, they are not insurmountable. By addressing the root causes of addiction and implementing culturally relevant solutions, it is possible to reduce addiction rates and improve the overall well-being of Black communities. This requires a collective effort from individuals, families, community leaders, healthcare providers, and policymakers. Through education, empathy, and action, the Black community can overcome the challenges of alcohol addiction and create a healthier, more equitable future.